You doing all right?
Yeah, I'm doing good.
Great. All right, motion looks great. Let's take this thing off and then throw it away. How does that sound? So we're not going to test the stability of your elbow today because we're only 5-6 weeks. Mm-hmm. We'll wait till the 4-month mark to do that. We don't really want to do that. Wow, that's much better than most people at this stage in terms of no swelling, great motion. Comfortable. Okay, so you're going to go down and see Mickey now, and he'll teach you how to reattach your arm to your brain.
Yeah.
All right. And yeah, exactly. So and then just ask him any questions that you might have about what to do and what not to do in terms of strengthening. He'll be very specific with you, and everything's going to be good. All right.
All right.
We're done with the worst part now. The therapy's more fun.
The fun part begins.
And then we'll see each other again in 3 months, and then we'll start to throw.
Okay.
All right?
That's good.
Good to see you. Okay.
So when was the injury?
Late June.
June, while you were pitching?
Yeah.
Do you just pitch?
Yeah.
Okay. And the surgery was when?
The 21st of July.
So you're out of the brace today, right?
Yeah.
Okay. We want you to get all the motion by yourself. We don't want
Okay.
anybody pushing on it or pulling on it. And generally with Dr. Altchek's techniques, that's not usually a problem. So
Okay.
just want to take a look at your motion now. All right, bend your elbow up. Okay, now straighten it out. Good. Okay. You're only lacking about 10 degrees of extension, which is already enough to throw, so we don't want anybody pulling on you. You're bending, you've got about 95 degrees of flexion. That will come. Mm-hmm. All right. It's rare that one of Dr. Altchek's techniques has a problem getting their motion back, and therapists will be in touch with me if for some reason, it is a problem, but I don't anticipate this being a problem. So what you're going to start doing today on your own is lie down on your back, and we're just going to put a little towel roll under your elbow. All this stuff is in the packet that we give you. And you're going to just gently bend it up, just so you feel a stretch, and then straighten it out.
All the way straight now?
Well, go as far as you can, but don't kill yourself. You've already got a lot of extension to begin with, so. And you're going to do this a few times a day.
Okay.
Like 3 sets of 10. And then after you've done a few sets, what you'll do now, the way we're going to get your extension back is just using gravity.
Uh-huh.
So you're just going to let that hang and start out with about a minute. Nobody pushing on it. You're just going to let it hang for a minute, and you can work your way up to about 5 minutes. Okay. It looks like you're going to be completely straight within this week, so that's not really anything we're going to have to worry about. So, okay?
Nice.
And then what you're going to do, let's have you sit over the edge. We just want to get your scapular muscles activated, so you're going to, if you notice, you sit like a pitcher hunched over. So we want to just tighten those muscles up, hold for 5 seconds, and then rest for 5 seconds. And then next week we'll let you start working with some of the resistive bands. And this is really the key to the rehab, is that scapula. Good. And then what you're going to do, since you took that graft from here, is you're just going to do some wrist range of motion. Now, one of the things that we do differently than, say, some of the other doctors is we don't do any isolated forearm exercises for about a year.
Okay.
Because most pitchers don't have weakness there anyhow. What ends up happening is you do too much and you inflame that muscle there, that flexor pronator.
Okay. So like in the future, would I be able to deadlift?
Oh yeah. You'll be able to do anything you want once you start throwing. We just don't want to isolate those muscles right now. So, and then I'm going to give you a couple of isometrics to start doing for your shoulder now. So you're going to do is just with your elbow bent, just push into the wall, tighten up this muscle in the front of your shoulder, hold it for 5 seconds, and then rest for 5 seconds. And it shouldn't be painful. And we're going to do that 20 times. And then we're going to turn around and we're going to go the other way. So you're going to push back into the wall like that. Really, the key to this whole rehab is the shoulder and the scapula. The elbow is just going for the ride. So those are the exercises you're going to start with now. We'll probably want to see you again, so hopefully you'll
Yeah, you said 3 months? 3 months,
yeah, 3 months from today, and then you'll see me when you see Dr. Altchek.
Okay.
And then gear yourself to starting a throwing program at about 4 months
Okay.
post-op. Probably not off the mound till about 9 months
Okay.
post-op. And then think about it at least a year for a game situation. So kind of gear yourself to that. In other words, the throwing program is designed to gradually load that graft. It's got to both get stronger and more flexible. And we'll just kind of guide you along. Pain is the main guideline. That's why I say don't run for a few more weeks, because we live in an imperfect world.
Yeah.
People fall.
Is the bike fine?
Bike is fine. You can get on the elliptical. I wouldn't use the arm piece of the elliptical yet. And let's not do anything that interferes with you getting your motion, your strength back in your elbow. What we don't want is anybody have to pull on his elbow, but he's already got, you don't need full extension to throw.
Okay.
But he's already got enough extension to throw now, so that's why nobody's going to crank on his elbow at all.
All right.
That ligament takes a long time, and it's the only
No rush to get
stabilizing
back.
function on that side of the elbow.
I'll take my time.
Yeah.
Yeah.
Stick to the program.
All right.
All right.
I'll
Thanks
see
a
you in a
lot.
few months then.